All right. So this one is meant to be a workshop. It's meant to be more interactive. And as I mentioned earlier, if you're here for the first session, here I'm going to provide some examples of the tools and activities that we've been doing both in our CBT program and our mindfulness. I know we're running a little short on time, so we'll kind of go through this and see what we can get through. And I'll also say, these programs are designed for small groups. I've never actually done some of these in a larger group format, but if you'll bear with me, we'll do our best and have some fun with this. Okay. So my disclosures have not changed. And again, I don't think anything here is in conflict. This is, if you weren't here earlier, this is kind of the quick summary that basically we do have hypersomnia treatments that are effective for reducing sleepiness, but what it doesn't really address and what the unmet need is a therapy for people with narcolepsy and people with idiopathic hypersomnia that can improve quality of life, that can reduce sleepiness, reduce depression and anxiety. So that's really the foundation for why we need a psychosocial intervention for hypersomnia. So I talked before, we have these two programs, what we're calling CBTH, which stands for Cognitive Behavior Therapy for Hypersomnia. And just so you know where that came from, we went through different ideas for names, and since there is a CBTI, Cognitive Behavior Therapy for Insomnia, that's pretty well established and actually is now the first line treatment for insomnia, we thought that CBTH would be a good parallel to it. We thought about CBTN, but then we're like, well, it's more than just narcolepsy. CBTN, IH seem complicated. So anyways, it's not exactly the easiest name, but it's what we felt was going to be work out the best. I'll talk about the mindfulness program as well. The mindfulness program that we use is adapted from Jon Kabat-Zinn's program. He sort of, I mentioned earlier, is kind of the godfather of using mindfulness, teaching it in classes. He has done his work out at University of Massachusetts. That's kind of where the Center for Mindfulness is located. So we made some adaptations from that program. So let me talk first about CBTH. And I'll give you a little bit of background, and since we're a little short on time, I won't go through all of this, but basically it was designed as a 6-session program. Again, if you were here for the first one, we did it in groups and individual. There's some pros and cons. I think one of the pros that we talked about is the social aspect of being in a group. The main pro of individual is that you can make it more customized. There's some pros for both of those and some potential cons as well. But so far it seems that the group program is a little more favorable. As I mentioned earlier, we had this in modules. That way it can be customized to each person. And some may not be necessary, like the first module is education about narcolepsy and idiopathic hypersomnia, whatever the person has or whatever is relevant for the group. If it's someone who has already done this work, has done the research, then this might not be needed, but we oftentimes just check to make sure people understand what their condition is, answer any questions about what it is, about treatments for it, and so forth. Other things such as the self-identity, self-image, I'll talk a little bit more about that. Structured daytime activities, we'll talk about that as well. So you can see there's these different modules that people can kind of pick and choose from. And as I mentioned earlier, CBTH is meant to be an adjunct to standard treatment, which right now is medication. So, it's not meant to replace it. It's really meant to supplement it. Okay. So the theoretical background here, this is where it came from. So as far as the contents and delivery methods, they were mostly informed, first and foremost, by you guys, stakeholder input. We asked people, we gathered information, both formally as well as informally. There's studies that both we've done on psychosocial challenges, which I presented earlier, and there's certainly other people. We're not the only people who've done this work, but especially nurses have done a lot of work in terms of support and emotional aspects of narcolepsy. We gathered some of the information from those studies. We also took a look at evidence-based psychosocial interventions in other conditions. So for example, in cancer, there's actually quite a bit of evidence that social support can improve cancer recovery and outcomes. And so there's some tools there that we've looked into and used here. Chronic pain is another condition that has some similarities, this unrelenting and kind of up and down aspect of chronic pain. So there's some tools there for managing chronic pain that we've used. And also, same thing with chronic worry. And then lastly, anecdotal clinical experience. So I mentioned earlier, I'm a licensed clinical psychologist. So, up until I transitioned to my current position at Knox Health, I had a practice at the sleep disorders clinic at Northwestern and other places before that. So there's some things that I had learned directly from patients that we kind of put into this. And the framework is a cognitive behavioral framework. And actually, I talked about this a little bit earlier. So we have some things from stress and coping that are within the cognitive behavioral framework, behavioral theory. So things like monitoring and logging is pretty big. So I have, like, if you can see here, this is an Oura Ring here. This is one of those wearables. I'm sure people out there have their Apple Watches and other wearable devices. So a lot of this comes from behavior theories, where the more you monitor something, the more it helps you make a change, especially if you put in reinforcement schedules. So, we've used some of that in our programs, and also time management. Okay, so that's not exactly something that's traditionally in a cognitive behavioral framework, but I think a lot of the ideas behind time management actually fit pretty well. So let's talk about some tools, and I thought we could start off by maybe trying to do this and have a little bit of fun with what we call the nurturing depleting exercise. So if you want to participate in this, what you need is either a piece of paper and a pen, or if you have a tablet or a computer, something to write on. Okay, so if you have that and you want to play along, please do so. If you want to just sort of observe and watch, that's fine too. But if you want to play along here, what I'd like you to do is think about all the different activities that occur on a typical day, okay? And just write a list of these things down. If you want a little bit of guidance, people typically say, wake up, get out of bed. Okay? Next would be like, make coffee, eat breakfast, brush teeth, take a shower, okay? And again, if you want some guidance, I'd say most people end up with about maybe 20 or 30, some a little bit less than that, some a little bit more. So if you want, I'll give you a minute or two here to just write down a list of all the different things that you do on a typical day. And when you're done, if you want to look up, and I'll kind of monitor the room to see when most people are done. So it looks like some are still working. I see a few people that look like they're finishing up. So if you've finished, or if you're just finishing up, take your time. If you're finished, what I want you to do is go through each activity and think about the energy transaction for that activity. So for example, if it's an activity that gives you energy, we would consider that to be a nurturing activity. Okay, so if that's the case, write an N next to that activity. If it's an activity that seems to take away energy or sort of zaps you, then we would call that a depleting activity. So in that case, write a D next to it. This is subjective, so I just ask that you make your best determination. And if you come across an activity that some days it's an N, some days it's a D, it's kind of hard to tell, just make your best determination that on a typical basis, is it more often an N or a D? And that way each one just has an N or a D just for the sake of this exercise. Okay? So I'll give you a minute or two to go through and assign N's or D's to each of your activities. And as you're assigning your N's or the D's, when you finish up with that, then at the end, if you can count up the number of N's that you have and the number of D's that you have, and just write the total for each at the bottom. Do you have a question? Try to assign it, based on whatever, if you think that there's any needle that it might move towards, yeah. So again, just for the sake of this, if you really can't tell, you can leave it blank, yeah. So it looks like some people are still finishing up. I see some people looking up. So if you're still finishing up, again, take your time, finish up. What I wanted to do is kind of walk through this the way we would do it in our program. So if we have a volunteer who might be willing to share their list, and I'll kind of walk you through the steps that we take to kind of process this and kind of use it. So anybody willing to share their list? Want to walk through this? Okay, I see a brave soul over there. So what I want you to do is just first start off by just telling us each activity, and if you can, tell us whether it's an N or a D. And yeah, if you can, maybe walk to the microphone so we can all hear you, okay?
Wake up. N, read my phone. D, make coffee. N, wake up my kids and get them ready for school, usually a D. Eat breakfast. N, work out at some point during the day, definitely an N. Shower. N, work, emails, phone calls. Totally varies on the day. Okay. But figure out what we're going to have for dinner. That's a D. Go to the grocery store, all that stuff. Attend kids' soccer game, drive them to practice. Actually, I'll split it. Attend a game, that's an N. Take them to practice, that's a D. Make dinner, that's an N. Clean up after dinner, that's a D. Watch TV, depend. These days, probably more of a D. Read before dinner, read before bed, N. Read the news throughout the day, kind of a D. And lights out, that's an N.
Okay, thank you for sharing. Can you tell us how many N's you have and how many D's you have?
I had about 11 N's and 6 D's.
6
so.
D's.
Yeah.
11 to 6. Okay. Yeah. So basically, it sounds like you said 11 N's, about 6 D's. So one way to think about this is it gives you a sense of where your energy transactions are going on a typical day. So in your case, it's almost 2 to 1 that you have more N's than D's. So your energy transactions are more in the nurturing direction. So you should be getting more energy on a day-to-day basis. Okay, at least just based on this rough estimate. So that's kind of what this does. As a first step, it gives us an idea of where our energy transactions are. So, others may have a more even ratio, maybe like 10 to 10. In that case, it's sort of balanced. Some people may even have more depleting activities than nurturing activities. And so, for those people, then you might be more and more tired. So then what this gives us is an opportunity to say, okay, what can we do to rebalance our energy transactions? All right. So, for example, here, one would be, can you do more ends in your day? So, again, if I could just sort of pick your brain and your list, are there certain ends that you're doing now that maybe you could do a little bit more of throughout the day? I realize you already have a pretty good amount of ends.
Well, that was going to be my question, because the first exercise says that all N's and D's are created equal in terms of the length of time that I spent and the degree to which they either nurture or deplete. So that aside, what was my question?
Are there ways that you can do more ends? So just the activity right now.
Yeah, I could work out longer.
Okay, yeah. Or like sometimes when it comes to like exercising and working out, it might be like, okay, you might have your regular workout, maybe you take like a walk later on, something like that, right? So just to kind of give you guys an example of ways that you might be able to bring more ends into your day, okay? The other way you can rebalance it would be to do fewer Ds. So if I was to ask you, just looking at your list of Ds, are there things that you can do less of?
Sure, I could have my children do more of cleaning up and managing things around the house.
Okay. Give them some autonomy and responsibility, right?
More autonomy.
Okay. I have a 3 and a 5-year-old, so we're struggling with that. So, so just, again, just as an example, we kind of walk through this, and part of this is just practical problem solving or creative problem solving in some instances, because, again, with that ratio, you can also have it more, leaning towards the ends, more nurturing, if you can decrease some depleting activities. Now, oftentimes that's difficult. So then the third thing is it possible to turn some D's into N's? And this is where we get into that subjectivity, right? This is where it's a bit of a Jedi mind trick, but are there certain activities that maybe you had as a D that you could turn into an N? So, just kind of hearing what you were saying, I guess, one example that comes up would be like, you said watching TV, you said, these days it's more of a D, would probably hit. I know that, just being in Atlanta here, I've seen all sorts of negative political ads. That certainly can be depleting. Maybe you could choose to watch a different program. Maybe you could stream something that doesn't have any ads, something like that. But, so just, again, a creative way that maybe the same activity, if you can't change the activity, or in this case, maybe you don't want to, you could still do it in a more nurturing way. So, this, just so you guys know, this actually came from a technique that they use for people with depression. But what I find is that because it involves energy transactions, and that's so fundamental to people with narcolepsy and IH, that this seemed to be a useful activity. And the feedback we've received is that people really like it. Okay. Any questions, comments, thoughts about this? Have you guys been through anything like this before? It's not a typical activity. This isn't something that usually is taught in other CBT programs, but it's something that I thought would be useful.
I have
Yes.
a comment. My daughter was like, okay, I love writing, but it's exhausting. So it's something she loves to do, but because of the narcolepsy, it is exhausting for her. So how can she turn that into a nurturing if it's really tiring?
Good question. Well, let's think creatively. What aspect of it might be, if you're willing to share, are there certain aspects of the writing that are depleting for you or exhausting? Like, is it actually like the physically writing it? Is it the thinking? Is there something more of the thinking? Okay, all right. If I was to try to dig a little deeper, is it like thinking about trying to organize your thoughts? Is it just having ideas, or what is it? Organizing is okay. So here's one idea. My wife is actually a writer, and so one of the things she does is that for the first 3 minutes when she writes, she just does a brain dump. She doesn't edit, she doesn't organize, she doesn't care, she just does a brain dump. So maybe what you could do is to just spend at least a couple of minutes just letting it go. And so whatever comes to your mind, you don't have to criticize, you don't have to edit, it doesn't have to be perfect, you just let it go, okay? And maybe you just stop at that point. And so the idea here is, I think that's a good one because you're right. I mean, writing is a very complicated activity, right? It takes, it's cognitive, it's somewhat behavioral, you have to have the energy. But if there's a way that you can do it, maybe a small aspect of it, just to start off, and then maybe that 2 minutes could grow to 4, and then maybe 8, and then maybe 10. And what my wife will say is that sometimes as she gets the juices flowing, it's like anything. When you're exercising, you got to warm up first, right? You can't just get up and start sprinting. You pull a muscle, and if you're old like me, your joints will tell you can't do it. But if maybe you warm up a little bit, you prepare yourself, then it gets a little bit easier. Okay, so just hopefully that'll just give you some ideas to kind of run with. But this is kind of what we do, right? And so we get into, so part of this is to pull out these type of things, these type of challenges, and to see how we can work with them maybe in a creative way. Okay? All right. So in the interest of time, I'll move on here. So another one, this one I'll just kind of talk out a little bit. This is called the Pomodoro technique. And this one is actually inspired both by a sleep neurologist I worked with when I was at Rush University Medical Center. Her name was Dr. Margaret Park. She had this really creative and interesting way of talking to narcolepsy patients, saying that, look, for most people, we think of wakefulness as the time that we get up until the time that we go to bed. And for most people, it's like 14 to 16 hours. But maybe if you have narcolepsy, you can't think of a day that way. You have to break it down into smaller chunks, okay? And so in a way, it's a cognitive technique in that you have to kind of reconceptualize or rethink wakefulness into smaller chunks that might be different than what other people do. And also, like a patient told me about that he would use this thing called the Pomodoro technique. So the first thing I was like, a Pomodoro, isn't that a tomato? And so as I learned more, I researched it. So apparently, like the person who came up with it was a time management strategy where I guess initially they used a Pomodoro tomato that has a timer. That's why I have a picture over there. That's how they kept track of it and split things up into smaller chunks. So basically, that's sort of the idea here. It's a makeover of how you spend your waking hours. You divide these into different segments, and that way, in shorter chunks, it's a little bit easier to manage energy, for like 2 to 3 hours versus like 14 to 16 hours. We can customize this for each person based on what's going on, what your symptom, your waxing and waning, your lifestyle, responsibilities, you have to take care of kids or so forth, you have work duties, so we can customize it. And then the other thing is using diaries, alarms, social support to try to reinforce the structure. It's okay to have support. You don't have to use sheer willpower for this. That takes even more energy, right? So it's okay sometimes to rely on other things to keep things into place. The one thing I'll say that sometimes we hear in feedback is that structure seems confining. Okay, and I do want to comment on this because the idea here is that we're not trying to make this more rigid. We're just trying to give people a map that they can follow, and it's meant to be easier. And if the point isn't to follow this to a T. The point is that it gives you some structure so that you just have a plan and you're just executing the plan. If it deviates a little bit, that's not the end of the world. If on certain days, like something comes up and you can't entirely follow it, that's fine. But if you have the structure, you go back to it, then at least that gives you that plan. So ultimately, over time, it should make it easier. Okay, so I do want to make that point that it's not meant to confine. And a lot of times when we're doing this, what we do is we get a wake-sleep diary. So usually in sleep medicine, we talk about sleep diaries. That's usually focused on what happens during the night. Here, we want to know what happens during the day. So this is just one example. We've just, by convenience, split this up in the morning, afternoon, and evening, and have some naps in between. But this varies a lot from person to person, so we give people a lot of flexibility to let us know what's going on in their lives during the day. And after about a week or two of these diaries, then we can sit down, we have a little bit more information. We can kind of go through this Pomodoro technique and find ways to split up the day into different segments. Okay? All right. And then this next one is finding your identity. Again, I think we're a little short on time. I was going to kind of see if we could go through this, but I do want to talk a little bit about mindfulness as well. So I'll just kind of talk this one out. So this is something that I think is helpful to get a sense of where people are in their journey with processing their diagnosis and so forth. What we usually do is ask people to find something that represents who they are, whether it's an item, a symbol. We ask them to bring it to the sessions. If it's a group session, we ask them to share, what it is, what it means, what's the story behind this, why did you choose this item? And then we ask them questions just to get a sense of what it means to them. Like, has this changed since you started having symptoms of narcolepsy? Are there ways that you can still be yourself even with narcolepsy symptoms? And again, this just gives us a sense of where people are. Have they processed it? Sometimes there's a bit of a grieving process in terms of there's a change from what you used to be able to do, to where you are now. And this starts to get to the stage of saying, okay, what do we need to do to try to process these things and start to move forward to be, to figure out who you are now. And I think in many ways, again, we can find some creative ways to be able to still be the person that you want to be. You may not be able to do everything. I've worked with people who wanted to be surgeons, and then with narcolepsy, they weren't sure if they could still do it. But maybe they could be a family practitioner. Maybe there's some other, area of medicine that they can pursue. So sometimes, even if you can't totally be what you really thought you wanted to be, there's still the core value. They wanted to help people. They wanted to be a physician. That's still there. Maybe it just, gets transferred to a slightly different specialty in this case. All right. So let me go into mindfulness here, because I think we're a little bit short on time. So, let's see, there we go. Okay, so, nowadays, I think as we talked earlier, mindfulness is everywhere. There is even a magazine called Mindfulness now. I took this picture at a grocery store that was close to my office at Northwestern a couple years ago. And if it's like next to the gum and the, other things at the checkout line, you're mainstream now, right? Just in case you're not familiar with it, mindfulness is really about bringing attention to the present moment experience in a non-judgmental manner. It's meditation itself is the activity or process of transformation that tends to embody attention, awareness, and compassion. And when you put these two things together, then mindfulness meditation is the practice of mindful awareness and self-compassion without attachment to outcomes. So the reason we have that last part in there is because you're not, at least from the tradition, again, this comes from the Buddhist tradition, you're not trying to do this to achieve anything necessarily. You're just doing it to create the space to allow yourself to be present. And if you can, you try to just let each moment unfold. It's really hard to do. It's a simple concept, but something that's really hard to do. So the way I kind of explain this, because those concepts can be a little abstract, is this with this idea of train spotting. Okay, so it's not the movie, even though I think the movie was actually kind of a cool movie in the, I guess it was the mid-90s. That kind of dates me, I guess. But if you're not familiar with the term train spotting, it's basically the hobby of watching trains, making observations, like noting their serial number, and you usually do it for long periods of time. So what happens is that people who are train spotters, they don't use trains for transportation, at least not in this context. They stay on the platform, they take pictures, they make observations, so they just note the quality of trains. It's a very different relationship with trains than the way most of us do. So when I lived in Chicago, I would take the train to work, and if you asked me, hey, what color was your train, or what number was your train, I wouldn't be able to tell you. I just mindlessly get into the train. It's my method of commuting, and then I expect it to take me from point A to point B, and I get off, right? But train spotters have a very different relationship. And so the idea here is that we can create a metaphor where practicing mindfulness meditation is like being a train spotter of the mind, okay? And what we're doing is, we're trying to watch all the different events and activities in our mind, so thoughts, emotions, as if those are trains passing through this train station, and what we're trying to do is just take a step back, stay on the platform, and just watch these things go by. Okay, so it's very challenging to do. It's a bit abstract, but that's kind of the idea. So what I was hoping to do, and I know we're a little short on time, but I think I'd like to do this still, is to lead you through a brief mindfulness practice, just so you get a little taste of what this is like. Okay? So if you would like to participate, and if you don't, that's fine. You can just sit there quietly and just watch. Get yourself first into a nice, comfortable position. And maybe just, if you have like a tablet or mobile device, maybe set that aside, turn it over even. You might want to silence it. You can stand, you can sit, you can, lay down if you like. And just, if you're comfortable, go ahead and close your eyes. And just take a moment first just to note any sensations that are present. Maybe it's the sensation of your legs, your bottom against a chair, your feet against the floor. If there's any pain or tension in your body, just kind of notice it. If you're able to, maybe see if you can release it. If you can't, that's okay. Just, again, observe. And taking a moment just to see what's present in the mind as well. Any thoughts? Maybe thinking about the next session, what's for lunch, what you had for breakfast. If those thoughts come up, that's fine. Just note that these are present. And then just slowly and gently bring your full attention to your breath. And if you can, bring it to the tip of the nose and see what sensations are present as the air enters your body on an inhalation, and then as the air exits the body on the exhalation. And sometimes as you're doing this practice, you may hear other sounds, noises, and that's okay. Just notice that a sound is present in the environment, and gently and with compassion, just bring your attention back to the breath. And then when you're ready, slowly allowing your attention to go from your breath back to the mind. And now imagining that your mind is like a busy train station, and your thoughts, emotions, anything that comes in and out of the mind is like a train. And if you can, just seeing if you can stand back on the platform and just being a train spotter of the mind, watching these thoughts and feelings go by, and just observing, noting. And if you find that you've jumped on one of these trains, you're starting to think and analyze, that's okay. This happens. It's completely normal. Just gently note that, oh, I've gotten on one of these trains, and see if you can gently and with self-compassion step back off the train, back on the platform, and just continue to be a train spotter of the mind, wherever you are. And then when you're ready, slowly bring your awareness from being a train spotter of the mind back to the breath. Again, just noting the sensations in the body on the inhalation and the sensations on the exhalation. Just noticing what happens as each breath unfolds. And then when you're ready, allowing your eyes to open and settling back into this space, in this room. Okay, so That is what a mindfulness meditation is like. I think in the interest of time, I know we're running out of time. Normally I would sit and we'd kind of process this a little bit, but I hope that at least gives you a little bit of a taste of what it's like to do a mindfulness meditation. In this case, this is a quiet meditation. We talked about self-compassion. Looks like a couple things didn't make it on this slide. I'll highlight a few things. I'm going to start to go a little faster here so we can make it through some things. But the main thing with self-compassion is, you heard in the first session that there's a lot that people have told us, being ashamed of narcolepsy due to stigma, being hesitant or uncomfortable to talk to others, tell others that they have narcolepsy, and being tired of explaining why they're always tired. So these are some of the reasons why we thought self-compassion would be helpful. There is a specific meditation. Looks like there's part of this slide that's not on here. It's actually called a loving kindness meditation or a metta meditation. And in this meditation, what you do is you go through and you say these phrases to yourself. You start off by saying, may I be safe, may I be healthy, may I be free from harm, may I be at peace. Okay. And the idea is you're trying to cultivate a sense of compassion, first for yourself. And then you start to repeat these phrases for others. Benefactors, these are usually people that are close to you, a family or friend. And then you extend this to acquaintances, people that you have some relationship with, but you may not know very well. And then one that's really hard are enemies or somebody who you're in conflict with. The idea here is that everybody deserves compassion, from ourselves as well as other people. That's oftentimes really difficult for people. And then since this comes from a Buddhist tradition, it's all sentient beings. So, when I first learned this, I remember talking to my teacher and saying, I thought you said this wasn't religious. This feels like prayer to me. And it kind of does, but the explanation I was given is that, while yes, you are kind of like wishing well-being for yourself and others, but what it is it's really an act to practice and cultivate self-compassion. And right now there's so much negativity. We just talked about like television ads. Many of these are really negative. They come across as being mean-spirited. They're attacking. There's so much that we get bombarded with that's negative that it's difficult to remember about being compassionate, to ourselves and others. So this is one step to just practice that and have a space to do that. So that's really the intention behind it. It's not meant to be religious at all. I also want to talk for a moment about active acceptance because I think this sometimes gets misunderstood. So first of all, it isn't giving up or feeling resigned to just be like, oh, I have narcolepsy, I'm screwed, that's it, okay? It's actually a choice. So active acceptance is choosing to embrace, or some people would say acknowledge. So it's choosing to embrace or acknowledge that you have narcolepsy and that you're willing to find a way to work with whatever is happening in this moment, even if symptoms aren't present, okay? So it is an active choice in that way. Now, you might be wondering, well, why bother with this? Well, mainly because avoidance is the opposite of acceptance. And there is a lot of research that shows that when you avoid, it leads to things like anxiety, it leads to stress, it leads to rigid responses, okay? So while we don't have control over having narcolepsy or being diagnosed with it, we do have some control over how you respond to narcolepsy. So that's a space that we want to try to work with there, that then can at least give you some control even in a situation that seems totally uncontrollable. So if we have a moment, I would like to read this because this is something that we usually do with active acceptance. So this is a poem. It's called The Guest House by Rumi. This being human is a guest house. Every morning a new arrival, a joy, a depression, a meanness. Some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they're a crowd of sorrows who violently sweep your house, empty of its furniture. Still, treat each guest honorably. He may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door, laughing, and invite them in. Be grateful for whoever comes, because each has been sent as a guide from beyond. Okay. So, some of the themes that people oftentimes talk about with this is sort of the contrast that, like, we don't normally think about inviting like these type of guests, the way they talk about it in this poem. But this sort of goes along with this idea of active acceptance, because it's to be okay with whatever is present and to actually embrace and invite them. We can work with all of this. Okay, so let me just jump ahead here. With the evidence, as I mentioned earlier, we're sort of in the early stages, so we hope that they're coming soon. But in the meantime, how can you get help? So the first thing is talk to your doctor. Let them know if you're struggling with mental health or you need help coping. I think they can help provide guidance. If there's one available, you can ask to see a BSM provider. That stands for Behavioral Sleep Medicine. There are some telehealth options. We have something that's called the Society of Behavioral Sleep Medicine, and they have this map where you can click on your state, and you should be able to find a provider or somebody who's a member of this organization, and that can serve as a first step. Usually these are people like myself who are sleep psychologists. There are some nurses, social workers, and even physicians in our network, but this is a good starting place, and they should all be trained to work with people with narcolepsy and idiopathic hypersomnia. The other thing I'll mention is that if you are working with a therapist, we've made our CBTH treatment manual available to anybody, any professional upon request. So they can send an email to me at my Northwestern email address, and I can give that out. It's just jason.ong@northwestern.edu. So first name dot last name @northwestern.edu. So I still have that email address, and now I have an auto reply that has a link to the treatment manual. So if you're working with a therapist and they're not familiar with narcolepsy, or they're interested in getting a hold of this manual, that's one way that they can do it. And I've had a ton of requests for this, so I think there is strong interest out there. All right, so that is it.
Thank you, Doctor. Thank you so much.